Ms. Harb?
Hi there, I'm Sonia Harb, and I'm chair of the Commission on Community Action and Economic Opportunity. And we're a commission that was appointed by the governor 3 years ago, and our charge is to deal with the conditions that affect poverty in Michigan and work to reduce poverty across the state. Now, our initial work involved going around the state and hearing from the people of Michigan, those low-income individuals that are living in poverty. We heard directly from them, their stories, their experiences, what's worked for them, what challenges they've faced. And we've taken that information and we really used it as a foundation in developing the content for this summit. We also are working diligently on formulating a set of clear recommendations that we are going to present to the governor. Our work will continue. The commission is a long-standing commission in government, and we are very honored to be able to serve the people of Michigan. And we're very honored to be here today.
Thank you. Mr. Borngesser?
Yes. Good morning. I'm Ron Borngesser. I'm the president of the Michigan Community Action Agency Association, the 30 community action agencies in Michigan that our goal and our mission is to eliminate poverty. We're across the nation, there's 1,000 community action agencies, and we do go back to the Lyndon Johnson War on Poverty. We're really pleased to be part of this effort today, and I'd like to thank Governor Granholm and Director Ahmed for being leaders in helping to shine the light again on the fact that we do have 36 million people in the United States living in poverty. Our role in this whole effort was to organize the poverty summits or poverty forums that took place last winter and throughout the state, and that culminated in this effort today. And the nice thing about this is that we're going to have people living in poverty at this summit. They're going to help us come up with the solutions that we're going to need to eliminate poverty. So we're pleased again to be part of it, and we look forward to a successful summit. Thank you.
Thank you. At this time, we're willing to take some questions. Please.
One of the main issues of the summit is going to be housing. And in the last time we had such a crisis in housing in this country, there was moratoriums declared on foreclosures. In many places, they were upheld by the Supreme Court. Governor Granholm, you've said you wanted to allow the legislators to pass a moratorium. You personally have the authority to declare a state of emergency and declare a foreclosure moratorium. Are you willing to do so?
I don't have, I mean, if I had the authority, I wouldn't ask the legislature to do it for me. Well, but a state of emergency doesn't get the ability to declare a moratorium on foreclosures. And that's the thing, is that I've asked the legislature in this lame duck before they leave to give us the ability to declare a 90-day moratorium on foreclosures for those, so they could work out payment plans so that they can stay in their home. I hope the legislature acts. I hope they act before they leave. And, you know, this is why it dovetails, in fact, with what the president-elect would like to do, which is to see a national moratorium on foreclosures while people have the ability to work out there.
Bill 1306?
I don't.
The 2-year moratorium in Southern Michigan.
The Senate will not pass that bill. The Senate is not going to pass that bill because it doesn't have the support of the banking industry. We want to get something where we can get support in the House and the Senate, and that's why we've asked for a different strategy, which will allow us to declare that moratorium and get support of both the House and the Senate and the banking community too.
Anyone else? Yes.
You mentioned a couple things, Governor, with the EITC and the hike in the minimum wage. I'm wondering if anybody can talk about sort of things that you're, lobbying around, or things like that you know or think would help in situations that you're talking about.
Well, I think we'll be talking a little bit later about the question of universal health care in particular. The governor and the Department of Community Health have come forward with a request for a waiver to move toward universalizing health care in Michigan. That request, which requires a waiver from the federal government, has languished in Washington for over 2 years. We hope with this new administration, we believe with this new administration, that there will be a national change on this.
I would encourage you to look at page 9 through 13. It kind of identifies each of the areas that we're really trying to focus on, whether it's asset building, universal health care, children in poverty, early childhood, education, corrections in the Michigan Prisoner Reentry Program, our faith-based community efforts, as well as seniors in poverty. It kind of gives you somewhat of a discussion. And maybe Sonia, you could, or Ron, you can talk a little bit about the focus groups you had last fall and how that developed into what we're doing today.
Yes, that the reason behind the poverty forums was to let people in the community come to us and let us know what the barriers that they're facing that keep them in poverty. And the interesting thing about community action is that a third of our board of directors are individuals that are actually accessing our services or represent a group that does. So we've always been grassroots oriented, and every community is different. And so that's why the regions are set up that way, because everybody has different issues that they have to deal with. I'd like to just mention about the Earned Income Tax Credit Program, because that's a program that puts money into people's pockets, that turns right back into the economy. There's $5 billion of tax credit dollars that are not claimed on an annual basis because people don't know that it's available to them. So if we were able to put some additional resources behind a program like that, it really puts money back into the community and in people's pockets. Thank you.
Question back here.
Yes.
Yeah, you said you don't have the authority. Please explain that there's a rock-solid legal precedent. In 1930, governors across the country declared a moratorium on foreclosure and eviction, including Michigan. And those decisions were challenged at the Supreme Court and were upheld. So my question is, why can't you do the same? They say that this economic crisis is as bad, could be as bad as the Great Depression. Looking around Detroit, it's like a wasteland. There are people getting evicted left and right, and people who have jobs who could pay their mortgage, but Wall Street banks that own their mortgages won't renegotiate. Why don't you use that authority to declare a moratorium?
There is not a single governor in the country who has been able to declare a moratorium because it is not a strategy that has worked, and legally they don't have the authority to do it. What we want to do is a strategy that actually works to keep people in their homes. So that's why asking for the legislature to pass something that we can get through the legislature to declare a moratorium while people are able to stay in their homes is a strategy that we have deployed, including we've got through our Michigan Housing Development Authority, Save the Dream, which is a program that will allow people who are facing foreclosure to refinance. The bottom line is there is a series of initiatives that Michigan has undertaken to keep people in their homes. But with respect to declaring a moratorium, that's what we are working and asking the legislature to do before the end of this year so that we can do it legally and have it have the effect that we want, which is to keep people in their homes.
Mega?
One of the things I hear about from folks who call me is that it's the cost of their medical care that's putting them into the situation that we're all here for today. Is there any plan that you guys can chat about a little bit now that we can tell our readers some relief that may be coming in that regard?
Well, I can tell you that if the next administration believes it is a priority, and I think they do, to have a universal access to affordable health care program, that will be obviously a nationwide priority to keep people in insurance. The initiative that has been worked on through the Obama campaign and hopefully through the administration will allow people to be able to choose their doctor. It will work with the private sector, but have a partnership between government, an individual, and a business. That's exactly the kind of initiative that we have asked the federal government to give us the permission to do. It's what they did in Massachusetts. Unfortunately, after Massachusetts, the federal government declined any waivers after that. And so if we couldn't get it with the current administration, we intend to get it with the next for Michigan, and certainly the nation will get that as well.
So it would be a state-run program.
I think it'll be a federal program because my guess is they're not going to do it state by state. I think that the president-elect wants to do a nationwide program. Obviously, he's going to be able to speak to that. But in his campaign documents, he made it clear he wanted to see a nationwide universal access to affordable health care for all U.S. citizens, and that everybody has a chance to buy into it.